Okay, everybody, Dr. Ravich here from Vet Triage. We are continuing through this issue of JAVMA from June 1st, 2015, and we are going through a what is your diagnosis. So you can see the CT scan there as well. We're going to go through it. This is a 9-month-old mixed breed dog evaluated because of a bony swelling dorsal to the orbit, 2 months duration. So you can see this swelling right here where the asterisk is over the frontal sinus, and then here it is on the sagittal view. This is transverse, this is sagittal. The dog also had a history of lethargy and fever and pain. They tried non-steroidal anti-inflammatory drugs and antimicrobials without resolution. On palpation, 2 by 4 centimeter hard swelling dorsal to the left orbit was found. A complete blood count and a urinalysis was normal. Serum biochemistry analysis, mild hyperphosphatemia, and mild high alkaline phosphatase activity. Both those things they don't address here in the paper, but those are normal findings for a puppy who's growing. It indicates high bone turnover. And this study comes out of the Iowa State University Vet School. Diagnostic imaging findings and interpretation. They describe a focal zone of moderate fusiform expansion of the left frontal bone with heterogeneous mineral attenuation at the dorsalmost aspect of the left frontal sinus. The bony abnormalities have smooth margins, no osteolysis. Differentials include idiopathic calvarial hyperostosis, chronic reactive hyperostosis secondary to focal trauma, atypical inflammatory process, or neoplastic process. Treatment and outcome: 2 bone biopsies were collected and via a bone marrow aspiration needle. The histologic examination of the bony specimens revealed trabecular bone with a covering of fibrous tissue resembling periosteum. There was no evidence of neoplasia or inflammation found. No bacteria growth on the culture. So they diagnosed idiopathic calvarial hyperostosis. And this is considered self-limiting by the time the patient reaches sexual maturity and does not require any medical intervention. All right, comments. Idiopathic calvarial hyperostosis is a non-neoplastic osteopathy. Craniomandibular osteopathy and idiopathic calvarial hyperostosis occur in young dogs, usually 5 to 10 months of age, and can be painful. Originally, it was thought that idiopathic calvarial hyperostosis and craniomandibular osteopathy were the same syndrome. However, there have been multiple case reports that show distinctions between them. Craniomandibular osteopathy is a bilaterally irregular osteoproliferative disease that affects multiple bones of the cranium and the mandible and may occur sporadically in many breeds, whereas with idiopathic calvarial hyperostosis, there's an asymmetric periosteal thickening of the frontal and parietal bones, and it was originally reported in young bull mastiffs, and then also then in a pit bull type dog and English Springer Spaniel. And now for this dog, we've got a, what was it, a Cocker Spaniel here? Oh, this is a mixed breed dog, mixed breed. All right. Craniomandibular osteopathy has been compared with human infantile cortical hyperostosis, which is a proliferative bony condition of humans with similar radiographic and histologic findings. And this disease has a potential for partial to complete resolution. So that's it. This is very uncommon. I have seen both those conditions in animals, and what's important to know, let me just backtrack here, is the naming of these, because you might hear these words and think, well, it sounds kind of similar, but just break down the names. Calvarial hyperostosis, right? So you're talking about the calvarium. That makes sense. And it's hyperostosis, so increased bone formation. When you talk about craniomandibular osteopathy, yes, you have the cranio part in that word, which indicates the cranium, but also mandibular. And so you have to have the mandibular region involved as well. So it may not matter for the outcome if there's no treatment anyway, it's just palliative care until they resolve. But in terms of being specific about the diagnosis, that's kind of how you would determine it. But if you did collect radiographs or CT scan and these findings, these abnormalities were evident on those scans, then the radiologist would also help you, towards that way if you get a radiology report also. So, all right, cool case, fairly unique, or rather uncommon, and yeah, we'll see you guys again tomorrow. Take care.